So, the audience here should say today has come from the length and breadth of Scotland, and we have, what we'd intended was to have the most diverse audience possible. So while we do have lots of allied health professionals and other disciplines from across health and social care, we've also got people here from across the third sector, a whole range of other agencies, including representation from fire and rescue and justice service and education and a whole range of others besides. So a huge thank you to all of you for wanting to be part of this day. It's actually you that is going to help make this day a success. So I'm really grateful for you all to make the time to come here today. So the purpose of our event today is to hold a space, I think, for conversations that matter, to share our ideas, to share our creativity, and to challenge our thinking in how we support people to live healthy, active and independent lives. It is to introduce our AILIP programme, which we're very excited about, and to connect with the people in this room, but also the people beyond this room, in terms of our shared and common purpose, which is a thriving Scotland. How many of you have read The Tipping Point? Just out of interest, quite a few. I love the principles of The Tipping Point. I think the people in this room are probably connectors, people that link different sectors and parts of our public and third sector and independent sectors across Scotland. And I think that's part of what we hope to embody in the context of today, is to look at how we take what is effectively a really good idea and something I think everybody in this room is united behind, in how we support active and independent living, and how we mainstream that, how we support it to become how we do our business, and join some of those strategic dots across the infrastructure in Scotland. So we will talk about allied health professionals, since this programme is about how we marshal their leadership skills, their expertise and talents across the sectors towards that renewed focus on prevention and early intervention and enablement. But the important element here is recognise that we all have a contribution to improving health and wellbeing beyond the delivery of our traditional services, and that we are interdependent. And that we're more in the sum of our parts. I think that's really important. I believe it's going to be those interprofessional, interagency connections and partnerships, and with the people of Scotland, that will be the heart and soul of this programme as it evolves going forward. So we've been on a bit of a journey of discovery, I think, over the last year and a bit. It started very much with people who use services and really seeking to understand and explore the complex landscape of how people navigate health and social care services, recognising that's in the context of integration and the evolution of these new bodies of integrated joint boards, and the significant contributions have meant around the care sector, the third sector, and the range of partnership agencies. We've been blown away really by how many people want to work with us on this agenda, including education and justice and ambulance and fire rescue service, just to name a few. So we really have tried to seek first to understand what matters to people, what matters to them about their health and well-being, and we've been trying to connect across those sectors where we have people involved in sort of synergistic activities. We've worked with directors of public health, with culture and leisure, library service, building safer communities, and our colleagues in physical activity and fitness services. And so many people really are embracing this agenda of how we support the ambitions to help people live longer, healthier lives in their own homes or a homely setting. So in talking to policy colleagues, we've recognised there's still more that we can do, I think, to strengthen the connectivity with their strands of work in transforming primary care and population health, for example. And it's for that reason that we're delaying our publication of the document, to take the time to get those connections absolutely right, to mainstream and embed this work across all sectors. And I think you won't have to wait too long for this to happen, but this work is really too important for us to not take the time to get it just right, and an opportunity not to be missed. So, forward with the day, and it is my very great pleasure and privilege to now introduce our Cabinet Secretary for Health and Sport to get us off to a good start. Thank you, Cabinet Secretary.
Good morning, everyone. Thank you, Jackie, and what a good turnout, a full room, always good to see, and people, obviously, as Jackie said, from all over Scotland, but also from many different parts of the allied health professional community. And it's a pleasure to be here today to focus on the Active and Independent Living Improvement Programme. I love the rather catchy AILIP. I think it's a lot easier, quicker to say, and it is an opportunity, more importantly really, to celebrate the way that AHPs are working with partners across multidisciplinary and multi-agency teams, as Jackie just gave a flavour of in her opening remarks, and that's to drive the ambitions for prevention and early intervention as set out in the Health and Social Care Delivery Plan. Improving the health and well-being of the people of Scotland is my priority and the government's priority, and I'm sure it's the priority of everyone in this room also, and we have a contribution to make, and this programme provides an important vehicle to generate creative partnerships towards our common purpose and accelerate the pace and spread of effective practice at scale. A key strength of the programme is that it was formed by a wide and varied consultation process with events held across health, social care and the third sector, as well as with people who use services, their families and carers. AHPs are a diverse and of course talented group of professions. However, the engagement process told us that not everyone out there knows who they are and importantly how to get access to them. What was clear was that those people who have received help or treatment from an AHP hugely valued it and felt that they would have really benefited from that support being available earlier. AHPs have embraced the concept of co-production and are playing a key role in the ongoing integration of health and social care services. They're already optimising pathways and supporting delivery of personal outcome approaches, and their skills alongside those of other leaders and practitioners will also be key in underpinning the success of the transformational plan for primary care and sustainable GP services. In the Health and Social Care Delivery Plan, we've made a concerted effort to focus on prevention, early intervention and enablement. AILIP is integral to that plan through supporting people of all ages and abilities to live well, be physically active, manage their own health conditions better, remain in or return to employment and live independently at home or in a homely setting. And I want to recognise what has already been achieved within the context of the integration joint boards, including work to optimise pathways for frailty, intermediate care, hospital at home and rehabilitation and reablement initiatives that enable people to live longer in their own homes or in a homely setting. Alongside this is the important work of AHPs who do work to support the diagnosis and treatment of acutely ill people, including those on a cancer or palliative care journey. I'm clear that the full potential of the allied health professionals to deliver improvements for individuals, services and the system as a whole has yet to be fully realised. However, I am encouraged by what has been achieved to date through the programme's predecessor, the AHP National Delivery Plan, and I'm sure that this work will continue to be prioritised and reflected in local plans going forward. I just want to highlight some examples. The National Falls Programme will continue as an integral part of the Active and Independent Living Improvement Programme and will continue to identify and deliver activities that provide practical support to people who fall or are at risk of falling. In Scotland, falls prevention has transformed in the last few years. It's no longer the preserve of a small number of specialist health services, but the shared responsibility of everyone who works with older people. A range of professions and organisations in all sectors are now involved in falls prevention, response and management. A key focus for the coming year will be the continuing work in partnership with the Scottish Ambulance Service to implement their National Falls Pathway to reduce unnecessary conveyance to hospitals by 10%. And in addition, 50% of those people not conveyed to hospital will be referred to community AHP services for further assessment and rehabilitation. That's a huge impact and really an important part of our overall plan to keep people out of hospital who don't need to be there. In terms of musculoskeletal services, AHPs have delivered a whole system redesign of those services as part of optimising orthopaedic pathways, ensuring connectivity with mental health and return to work pathways. Work in this area continues to evolve with the introduction of the MSK Decision Support Tool, which was first developed in NHS Tayside, I'm proud to say. This comprehensive web-based tool provides a single point for MSK education and information across the NHS with the aim of ensuring consistency in the management of MSK problems. The tool includes video advice on assessment as well as signs and symptoms of MSK conditions. Patient information leaflets are also available giving evidence-based advice. The tool is available now and has been provided to every GP practice in Scotland as well as to a range of other health professionals. And also, I want to highlight Ready to Act, a transformational plan for children and young people, their parents, carers and families who require support from AHPs, highlights the critical place of prevention and enablement and promotes the least intrusive interventions through a tiered model of service design and delivery directly linked to wellbeing outcomes. The plan highlights the critical place that addressing children and young people's health and wellbeing has on their later life chances and experiences and on the use of health and social care resources. I know that John Swinney, the Cabinet Secretary for Education, is particularly interested in that, and the speech and language therapy services, and the fact that we know the connections of speech and language issues that can be identified preschool, never mind in early years of school, and how often, particularly, for example, young men within the prison system, how you can trace back those speech and language issues right back to preschool. So he's very interested in the role of AHPs and how we can join up the systems to make sure that we give those children the best chance in life. So he and I have spoken about that on many occasions. I want to, as well as these critical work streams continuing, and they are important and we want those to continue to evolve, it's also important to recognise that increasingly AHPs are shifting their focus to earlier in a person's health and wellbeing journey, away from the traditional models of provision in hospital to where people live their daily lives. Their current focus is on underpinning transformation of primary care, working closely with GPs and colleagues in multidisciplinary teams to optimise clinical pathways, support self-management and provide alternatives to admission to hospital if this is not required for the best care or support of the individual. Also, we know that being active has many health, social and economic benefits and reduces the risk of over 25 chronic conditions. Clearly, increasing population activity levels can help to reduce pressure on acute and primary care health services by reducing admissions and reducing prescribing and treatment costs. For these reasons, the Scottish Government is committed to increasing rates of physical activity. The Active Scotland Outcomes Framework sets out the ambitions for a more active Scotland and is underpinned by a commitment to equality. For some people, being active might seem a bit daunting, something that's not for them, but we want to challenge this and support people to do what they can to move more in a way that's safe and sensible for them. And health professionals have a crucial role to play here. AILIP will complement the broader work in physical activity by enabling AHPs to support people to be more active and improve their quality of life. And of course that's particularly beneficial to older people who are one of the groups at greatest risk of being inactive, yet can get the biggest benefit from that, with better physical health, reduced falls, improved cognitive function, which of course can delay the onset of dementia. Over 2/3 of adults in Scotland are overweight or obese, and by the time they reach primary school, 10% of Scotland's children will be obese. It's estimated that around 20,000 are currently at risk, and of course the position is worsening in deprived areas, with the pattern particularly marked among women, where obesity rates in the most deprived areas are 14% higher than in the least deprived areas. And the factors contributing are complex. A range of interventions are needed over the long term. There's not one magic bullet here. But we think AHPs again have a hugely important role to play. They will work with colleagues, including midwives, health visitors and school nurses, to build on the successful evidence-based interventions and develop multidisciplinary programmes to support early maternal nutrition, breastfeeding and healthy eating approaches for mums, dads and children. Working across agencies and with partners to support adults in the workplace in making healthy eating choices, and also working with GPs and other partners to explore and co-produce evidence-based approaches and pathways to support healthy eating within the older population. AHPs see well in excess of 2 million new patients every year. Each contact is an opportunity to discuss what matters to you, but also an opportunity to discuss what's important to your future health and well-being. AHPs will use every contact and clinical encounter to generate conversations that matter about that person's future health and well-being, in particular relating to physical activity and nutrition. The consultation carried out to develop AILIP suggested that AHPs were intervening too late in people's health and well-being journey, but there was no real evidence to support this claim. We're therefore asking every AHP working in adult services in Scotland to undertake the life curve survey with 2 people they see on a particular day. And it's hoped that this will provide for the first time a baseline of the stages in people's lives at which AHPs intervene. This data will help us address how best we can support older adults to age well. Ageing is unique to each of us, and many factors, whether it's family, occupations, social and environmental factors, affect how we age. It's common, however, for all people to lose, to a greater or lesser extent, their abilities to manage everyday activities independently as they grow older. If we know the activities a person cannot do independently now, the life curve model tells us which they will not be able to manage next. And this has huge importance for individuals and services. It can help people to identify current strengths and impending functional losses before they occur, and devise tailored earlier interventions to address, delay or even avoid them. Most importantly, it should inform the next phase of AILIP activity and how we shape our services across health and social care to enable people to remain independent, sustain their quality of life and be in their own home or a homely setting for as long as possible. This programme was co-produced with people who use services, their families and carers, as well as a wide range of stakeholders. If we're going to succeed in generating a fairer, more inclusive and healthier Scotland for all of us to live and work in, it will be the partnerships of people themselves and with other agencies and sectors who share AILIP's common purpose that will be pivotal to that success. Health and care professions can, of course, play their part, and the way this programme was developed shows how AHPs have listened to what people said in generating a clear direction for how they will catalyse our common purpose and drive future action and improvement initiatives towards this end. I'm impressed that AHPs have embraced this multi-agency approach and have used creativity and innovative approaches to build and strengthen partnerships across health and social care, the third sector, the independent sector, as well as other agencies such as the Fire and Rescue Service, Police and Justice, Education, Sport and Leisure Services. I am confident that AILIP, with your support, everybody in this room and beyond, can succeed in its bold ambition to co-create well-being with the people of Scotland. I hope you enjoy the rest of the day. I am looking forward to hearing the next couple of speakers before I have to head back to Parliament at the coffee break. But just let me end with a thank you to you all for the work that you do. I think that I know that the future of our health and care services will depend on the roles of the people in this room, and indeed some new roles that will be developed as we go forward with the new vision of health, doing far more in the community, more prevention, keeping people out of hospital. You all have a hugely important role to play in that, and in advocating for your service and what it can deliver and what your profession can deliver, and importantly encouraging young people to make positive choices in choosing careers such as yours, because we're going to need an awful lot of young people to do that. We need a lot of young people to work in our health and care professions going forward. So thank you for the work that you do now and into the future, and I hope you have a very successful and interesting day. Thank you.
Thank you so much, Cabinet Secretary, and a really good start, I think, to the agenda and the challenges that we have ahead. So it's an exciting time for us to be having these connections and conversations that matter, but a lot of work for us to do, I think, and a lot of cultural change for all of us to embrace in terms of how we work and how we seize those opportunities to make the most of conversations that matter. So our next speaker, I'm hugely grateful to Kevin for stepping into the breach and at short notice agreeing to be our speaker for this morning. And we were really keen to pay attention to the life course in its entirety. And I think while today we are focusing on the health and well-being of adults and in some cases older adults, we wanted to acknowledge that obviously getting it right for children and supporting children to get the best possible start in life is absolutely vital. Most of the HPs in this room will know that we've already kicked off our work around the transformational plan for children and young people, and some of you will be familiar with the work that's been done by the Royal College of Speech and Language Therapists about the intergenerational spiral, which is exactly what the Cabinet Secretary was alluding to. But Kevin has first-hand experience of that, and he now works for an organisation called Aid and Abet, is that right? But Kevin himself will tell you his story, a potted history of 21 years or so, thereabouts, in 15 minutes. Kevin, over to you.
Good morning, ladies and gentlemen. Really nice to be here. Yeah, I have 30 years and 15 minutes, so hold on tight. Hold on tight. You know, 30 years in the system, and you know, at the end, near the end of those 30 years, you know, I was broken, busted, disgusted, and could never be trusted. I was mentally, physically and emotionally bankrupt. And I was hopeless and many times homeless. You know, and it all goes way back early when there was no intervention for me. You know, 4 years old, Govan, Glasgow, watching a knife fight with my dad and two other men. Horrific scenes. 4 years of age. And when that event finished, nobody ever came up and says, "How are you, Kevin? How are you feeling? What's going for you?" Because at that time, it was absolute fear and terror. Absolute fear and terror in my life at that age. And nobody ever came up and says, "How about you?" At the age of 7, I was then moved with my family, 5 brothers and 3 sisters, large family to Glasgow. And we moved to West Lothian. And that move itself created more problems. New school, new community, new relationships. A young guy full of fear and anxiety and worry. And through that, you know, I couldn't communicate with people because nobody really came and says, "How are you, Kev? How do you feel?" Nobody explained about emotions and feelings, and so I always felt my own, even though I came from a large family. In fact, at times I never even felt part of the family. You know, I used to wonder if I was adopted, all that stuff. You know. At school, I was never involved in activity play. I never involved in a sports team, anything like that. Because I couldn't get involved. I was a shy guy, I was scared. And right into being the age of 13, through that school, running away from school, getting into trouble, you know, because I was full of fear and anxiety and couldn't really fit in. But at 13, all that fear was removed instantly. All that anxiety and worry was removed instantly. And I picked up alcohol. And I thought, wow, this is good. I need to maintain that stuff. You know, by the age of 17, I'm drinking a lot. I'm drinking alcoholically at 17. I'm in a young offenders institution in Pullman at this stage. You know, when I'm in there, I'm back to being scared and worried and petrified and anxiety and worry because I don't have my solution. It takes away that fear, anxiety and worry. I'll never go back. You know, I'll never go back to prison. I'll never go back to the young offenders institution. I'll come back into society and still nobody's saying, "How are you? How do you feel?" You know, and you know, and that was me for the next 20 odd years. You know, alcoholism turned into drug addiction, crack cocaine, intravenous heroin addict, years of it, in and out of prison. You know, And for all that time, I didn't have a purpose in life anymore. I didn't have a purpose in life. I only knew how to use drugs and get involved in crime. That's all I knew. No purpose. And in 2006, mid-2006, my house is surrounded by armed police officers. You know, they've come for a gunfight. You know, because I've committed a crime with a gun. They've come to get me. And I'm making a choice. I'm thinking in here, you know, great opportunity to end it, and I'll let them end it. Because that's where my head is, that's where my thinking is. You know, because see, being that young at 4 and all the way through, I slowly got conditioned by a belief system. And no positive role model in my life. You know. And through negotiators on the phone, they speak to me and they ask me to come out of the house. Let's not exchange fire. And I walk out of the house and I'm following specific, clear-cut directions because my life depends on it. And as I walk out and I'm looking at these armed officers, and they've got me standing like this, one step at a time. And I look across to this gunman, police officer, he's got the gun on me. And I glance down and I see the red dots here. And I think, this is for real. This is for real. That takes me into a long-term prison sentence in the system. In the system a long time. And in there they says, do you want to go for parole? Come out and get into parole, go to prison. Why? Why do I want to come out? Life's done. I'm in prison. I don't write letters because I've nobody to write to. I don't get visits because nobody's visiting me because I broke every relationship, mum, dad, brother, sister, son, everybody. It's had enough. And I'm in prison. And they said, do you want to move on? How do I do that? And they offered me CBT, cognitive behavioural therapy, self-management recovery training, alcohol awareness, drug awareness, talk about my feelings, thoughts and behaviours, consequences, empathy. I say to the prison officer, why now, man? Why now? Damage is done. The damage is done, guys. You know, I'm in here and the damage is done, and you're asking me to change the neural pathways in my brain, in my frontal lobe, in my decision maker, to change my life. You know, that's what I want to do now. Intervention when it's too late. You know, and I look at the guy and I look at the prison officers and I say to them, you know, this should have been done to me at 10. Thoughts, feelings, behaviours, consequences, actions. Why wait till I'm 39 and you ask me to change? This should be taken into schools now. This should be taken into schools now. And at that time I says to him, and I should take it into schools. He says to me, what makes you think it will work? What makes you think it will work? And I tell him the snowball story. You know, because when I was in first year at school, they brought a blind man to the school. He was collecting money for the blind bed raised. And that man came into the school, his dog, and he sat on the stage and we gave him a cheque and people were asking him questions. I always remember that day. What time is it? 2:30. 2:30. I thought, wow. You know. Questions about his dog and what his dog does for him. One kid says, do you dream? Do you dream? He says, yeah, I dream. Yeah, I dream. People born blind don't get visual. They get hearing and sound or whatever. He says, but I get to see. It's the only time I see. It's when I sleep. He says, because I could see until I was 12. And one other kid asked, what happened to you? How were you blind? He says, I got hit in the head with a snowball, with a big stone in it, and it knocked me stone blind. I stopped flinging snowballs. Even to this day, when I pick up a snowball, I think of that way, man. So I'm saying, if I can go into schools and talk about thoughts, feelings, behaviours and actions and consequences and talk about my life and what's been happening to me, it's not just a snowball we're talking about, it's life and death. Life and death. You know? And that prison officer looked at me and went, Kevin, you will never work in a school. You will never. You're a junkie. You're a heroin addict. You're an armed robber. You've caused many crimes. You will never, ever work in a school. Went back to my prison cell that night and I cried. And I cried. Not because of what he said, because I cried because I realised I had a purpose now. I had a purpose. You know, because I kept thinking about many kids who never had early intervention, who were living the same life as me, you know. It gave me a purpose. And I left prison. I left prison, went into a drug rehab centre, and I got clean and sober. And through that process, I done a lot of work on myself. I done a lot of search solding and digging and finding and really what was going on in my life, and it always went back to I was a kid. It could have been prevented. 30 years in the system could have been prevented. But at that time, where I was, growing up in the community, you know, alcoholism in my household, domestic violence, you know, there was many factors that played a part, you know. So after I came out of rehab and done that searching and some sort of personal development on myself, me and a couple other guys, we passed convictions in addiction, created the charity that I'm with today, Aid and Abet. That charity, what we do is we go into prisons, we're all in Scotland supporting and helping prisoners when they come out of prison, pick them up at the gate in the morning of release. We do it because we care. We do it because we care, you know. And it's broken adults. These guys are broken adults, just like I was broken, busted, disgusted, and could never be trusted. And we get to build these guys. But like anything that's broken, when you build it back up, there's always cracks and weak points, you know. And that's how we are as Aid and Abet. Then one day I get a phone call. Police. Last time I had a phone call for the police, we're talking about a house. We armed police officers. Now it's the police talking to me, saying, can you come in and see us, Kevin? We hear what you're doing in Edinburgh and Lothian. Find it very interesting. Guy doesn't trust police officers, or any form of authority at the time. I'm not to build relationships today, you know. And they're going to see these police officers, the VOW project, and they're going to see what they're doing. And the first time in my life I see cops with compassion. I see cops who care. Cops who are working with 16 to 25 year olds, you know, preventing them becoming broken adults. And they ask me, do you want to be part of this? Of course I do, man. Of course I do. I want to be part of this, man. Prevention, better than cure. If I can prevent any of these young guys having that state of mind, wow, man, what an opportunity, what a gift. So, you know, working with these cops and cons working together, you know, preventing 16 to 25 year olds from doing that life, the periphery of organised crime and drug addiction, you know. And you know, and looking back at that side that house with cops and that cop standing with a gun on me, you know, I see his face every day. I see his face every day. No one here, no one here. In the office, I work with him today. You know, the cop that was going to shoot me 11 years ago, he's my colleague, he's my partner, he's my friend today. You know, I see him every day, you know. And you know, and this is where we are today, you know, because I didn't have a purpose. I never had a purpose, you know. And then through the VOW project, the Police Scotland, and people trusting in me and I'm trusting in them, and we're really working to really prevent young guys and girls going into the system and pulling them out the system at that time. We get the Turn Your Life Around project. Turn Your Life Around project. You know, my life is turned right round, full circle. And I get asked to get involved in a project called Turn Your Life Around. Guys, I'm working in schools today. I'm in schools. You know, I get to work with primary school kids. Tomorrow I'll actually go speak to the parents because I've even got them coming in. You know, we get to work with parents. But none of this would be possible. See, going back to that prison officer who says to me, Kevin, you will never, ever work in the school. He was right. Of course he's right. But only through partnership. Because when I go to the school, the police come with me, and the council come with me, and we all go together. But these kids identify with me, you know, and the parents, you know. And it's about encouraging people to work with agencies, it's encouraging people to move on. You know, it's about letting people hold their dreams. Some of these kids have dreams. I didn't have a dream, I didn't have a purpose. But I found my purpose. It took the years in the criminal justice system, it took years in the system for me to find that purpose. You know, I don't stand here being big and smart today. You know, let me tell you, no many guys get it to my level. The premature deaths that happen to young people in the system, premature deaths, you know, which never is spoke about, you know. So for me, you know, I see a pattern working with these young kids, broken adults, preventing young adults becoming broken adults and kids, and there's a pattern comes up. See what happens at young ages, kids suffer bereavement, nobody talks about it. Things happen in their lives, nobody talks about it. They're left to deal with themselves. And as they get older, it's all buried in here. And when it comes out either through anger and aggression and violence, because it's all kept in here. Loss of a parent, whether the mother walks out of the household or the father walks out of the household, you know, someone's died in the family. These are the patterns we see. The events of the communities, you know, these are the patterns I get to see. We're working with broken adults, potentially young adults becoming broken adults in these kids, you know, and this is what we see is, you know, that sense of loss, that sense of emptiness. I spent many years feeling empty, you know. My purpose today is to prevent any of these young kids. You know, my job today is to let them hold on to their dreams. Let them hold on to their dreams and keep their dreams going. They don't have my nightmare. That's what I do today. I'd like to thank the event, you know, for having us here, allowing us to come and speak. You know, I'm not a public speaker. I'm not a professional psychologist or a psychiatrist. I'm just an expert in my life. So I'm an expert in my life. You know, I speak for the heart. You know, my intention is to try and hit somebody's heart in here. And if I have, don't come and tell me. Tell somebody sitting next to you in case they didn't hear. You know, I thank you all for your time. I wish you all well and all what you do. I think it's a wonderful event, and thanks for having me to speak. Thank you very much.
Follow that. Kevin, thank you. I mean, there is no substitute from hearing from somebody's lived experience. It's really powerful and a really moving story, and one of redemption and partnership and all of the things that I guess we're trying to embody in the work that we go forward. But nowhere more important than to start with an understanding that when we talk in health and well-being, we're not just talking about physical health, and we're not just talking about the absence of disease or illness. We're talking about emotional well-being, and we're absolutely talking about helping people live a life with meaning and purpose, and holding on to their dreams. So I think some lovely messages. Thank you so much. Okay, so in terms of that kind of acknowledging and paying tribute to getting the best possible start, we're then thinking about how we are as professionals or as individuals working to support people in their health and wellbeing journey, about how we play that part to the best of our ability, and sometimes working beyond our positional authority to influence some of the things that are going on at local level. I just wanted to kind of do a wee bit of a stock take in the programme and give Sarah the opportunity to talk about where this AILIP programme came from, you know, and what we're building on in taking forward the next phase of this work, that it didn't start on a platform of nothing. So Sarah, an opportunity to reflect on our journey.
Thank you, Jackie. And thank you, Kevin, for that. It's very humbling to hear, and I just want to reiterate that there's a lot of lessons and specifically around the work around aid and abet that we can learn from as professionals. So over the next 15 minutes, I'm going to talk to you about the AHP AILIP. I'm going to tell you how we got here in terms of the co-production, but also take you back in time to showcase some of the successes, but also put into the context why we're focusing, as Jackie said, on some of the areas coming forward from the National Delivery Plan. But I'd like you to all visit the AILIP stands which are out there, because we've got our national leads and our improvement advisors who can go into much more detail about the work programmes that we're going through. So I'm going to start with our vision. This is the vision for the programme. And I'd like to emphasise here how this programme is really aligned to the wider policy agenda, and how it really clearly aligns to the health and social care policy. But it's about the AHPs that will work in partnership with the people of Scotland to enable them to live healthy, active and independent lives, by supporting personal outcomes for health and well-being. So there is we have a strong policy commitment to focus on prevention and early intervention and integration. And I just want to say that the AHP workforce are very well placed and have the skill set to drive this agenda. So I'm going to take you back in time. Many of you will remember this, and the AHPs in the room, back to 2007, when we said we should, in the rehabilitation framework, which was actually a very ambitious and very aspirational document. And I was rereading it just the other day to look back and see where we've come. And I think, we have come a long way. Back in 2007, we said we should consider NHS function, 24's function, as a resource for rehabilitation, advice and triage. We also said we should consider the introduction of direct access to rehabilitation services, and we said we should consider maximising developments in e-health and telehealth. Fast forward to 2012 and now, we have gone far beyond considering, and we have now implemented an innovative and internationally recognised MATS, which is Musculoskeletal Advice and Triage Service. And this service has just been awarded the Scottish Government's Award for Improving Quality at the Advancing Healthcare Awards in March. Fraser Ferguson was there, and he was awarded this. And I just want to give you a quote from one of the judges, which said, "This project demonstrated excellent impact data that has revolutionised the service and could be rolled out to the rest of the UK." So back in 2007 we should consider it. Now we're being internationally recognised, and that is down to a lot of work from a lot of people in the room, and well, congratulations to Fraser and all of us who've been working so hard over the years for this. So just looking at this slide, so in terms of NHS function, 24's function as a resource for advice and triage, well, over 270,000 people have been triaged into the service. Per month, 7,000 people are triaged into the service. 69% of the population of Scotland are covered through the service, and 70% of all calls are answered within 90 seconds. And we've all been on the end of a phone listening to things, but 70% are answered within 90 seconds. So then looking at in terms of direct access, remember we should consider direct access. Well, this is actually, we know, in fact going back to the support, we know that actually what this means for people is that actually they get advice about their MSK condition really rapidly. So going on to the direct access, because of the slick triage processes, only those that need to be seen by a healthcare professional are sent on, and those that don't need to be seen get evidence-based self-management advice. Back in 2016, and I know this has even improved now in 2017, 15% of all the people who called the service were triaged successfully and actually didn't need to go and see the profession, but actually, didn't have to be seen, so were given that self-management advice. So they were given the most appropriate intervention, but actually that has a direct impact on the demand coming into the service, so in terms of the waiting times. And finally, we have embraced the whole telehealth agenda with the developments around the app and NHS Informs resource. So you can see 1.2 million page views and over 50,000 apps downloaded. So there are many transferable elements of this service, which is part of AILIP, we will be exploring with other AHP services, as well as build on the telehealth innovations. And again, I would recommend you visit the MSK stand. Senga is in the room, and she will very happily talk about all the innovations and the work that we're doing. So then we have 2012, and we have our national delivery plan. And I'm going to focus on two of the actions that we had in the delivery plan, and the AHPs amongst you and the directors will very remember fondly the fact we had 27 actions in the national delivery plan. Jackie, I'm looking at you. Thank you. So I'm going to focus on the action 6.1, quality of service delivery will be monitored through an agreed national data set and the target of 4 weeks. So if you take anything from this slide, it's if you don't count, you don't count. So we have been on a journey to ensure that AHP activity is captured on systems so that measuring the impact is done without being overly burdensome. And we know from the National Delivery Plan, and the AHP directors know, that how difficult it was to measure the impact of what we were doing through the National Delivery Plan. And the success and the impact can only be measured if we have clear, defined data sets that we can measure how we do. So this work is ongoing, and that's why we need to take it forward into the AILIP, and it's central to that. And it's been challenging, but we're now in phase 2 of the programme, whereby we have a defined bespoke data set for AHPs across Scotland from existing data. And now the work is ongoing to identify the state of readiness for board and partnerships to collect this data. And Ewan and Fiona are in the room. They'll be at one of the stands. We've got some information on the tables for you about the operational measures programme. So please do speak to them. And what if? So if we have these operational measures implemented nationally, then we have a source of standardised AHP data which we can record regularly. The benefits for this will include benchmarking, demonstrating the AHP contribution to both health and social care, the evidence base for more quality improvement, and looking at trends and predictive modelling. And we can use it for the wider public health, and also be seen as Scotland as an international leader in data, because this is not an issue, a problem just for us in Scotland about capturing this data, but across the world. And ultimately this will improve the pathways for the people who use our services. So very important that we have this, and we have this work stream ongoing through into what we're doing. A little bit more about the MSK. So we had the action in 2012 to have 4-week waits, which is again very ambitious. Amongst other things, we didn't really know any baseline, but we knew that we had waits of over 20 weeks within our MSK services. And now we know that 50% or 6% are seen within 4 weeks, and 80% are seen within the 12 weeks. But what I want to really focus on and emphasise here is the fact that this MSK programme is not a standalone AHP programme. It is embedded into the wider orthopaedic quality drive and modern outpatients programme. It is a central tenet to that programme. And because of the work that the AHPs are doing in the first part of this journey, there have been effects way beyond. So for example, in terms of orthopaedic conversion, which earlier was sitting between 11 and 35%, is now greater than 65%, but orthopaedic weights, MRI scanning, and I could go on. And again, visit Senga, she's here. And you'll see this, that how we're doing. So it's much wider, and it's part of a much more integrated, embedded programme. So again, the importance of this, the transferable things from this programme which we can take into other AHP programmes. And so this brings us to the now, and obviously we've been on this improvement journey. So this has given you a little bit about why we're carrying on with these programmes, and I'll just like to focus a little bit about how we got here. So the Cabinet Secretary has already talked about the fact that we co-produced this. We did an extensive series of engagement events. We met with over 1,000 delegates. We had Gria's in the room. She set up the Survey Monkey, which we had many inputs into that. So in total we had over 7,000 responses to 3 powerful questions that we asked. And we asked these questions about what was important to people to keep them healthy, active and independent, and what should AHPs do to contribute to this. And this led to our ambitions. And the ambitions are around making services, promoting health and well-being and early intervention, making services accessible, the awareness of services, about working in partnership, about delivering excellence through research and innovation, and about having a workforce that is equipped to contribute to the future health and social care requirements of the population. This is our AILIP vision for the AHPs who work across health and social care. But actually you could take AHP, this is relevant to all services delivering health and social care to the people of Scotland. And these, again, as I said, were co-produced. So every programme that we're focusing on around our AHP activity, we should be looking at these ambitions and trying to address each and every one of these things, because this is what people came back and said, we need to focus on that. And I think we've got good success stories around some of our programmes already about improving the access to the services, but we need to do a lot more. So building on our successes and looking at our new initiatives. So within the programme, I've talked a lot about the MSK programme, but going forward we're developing a web-based access to the services. We're looking at how the programme can better support GPs going forward and the emerging GP clusters. Within our Falls programme, we have the Falls Consensus Statement on Falls Prevention. We're doing the work with our colleagues within Living Well in Communities, and the ambulance pathways, looking at the falls and frailty pathways. We have our Children and Young Persons programme around the Ready to Act. We have our dementia programme, and that's due to be launched in June, around connecting people, connecting support, and that's about the transforming the AHP's contribution to supporting people living with dementia in Scotland. And then, as I said, we have our operational measures. So we're going to continue building on the successes of these programmes and looking how a lot of this can be transferred into other programmes. But we have some very interesting and exciting new initiatives around, for example, our vocational rehabilitation programme, the implementation of the AHP Fit Note, the development of a vocational rehabilitation education framework, and integrated vocational rehabilitation pathways. And again, at the stand, Gria and Senga are there to talk more about these programmes, and Lisa and a few of the other AHPs to support that. We're then looking at scoping of what the AHP contribution is to anticipatory care, and linking that again, because obviously we're linking in with all the other work streams, so linking in with the Living Well in Communities anticipatory care work stream. And then our whole approach to prevention and early intervention, with a focus on what the AHP workforce can contribute to getting people more active, whether that be universal approaches or more targeted approaches to the vulnerable groups. We will look at these 3 well-being initiatives, the Move and Improve, Eat Well, and Making Every Communication Count, and identify what this means for children and young people, for people of working age, and for older people. And finally, we'll be looking at the life curve and the data that we'll get from the life curve. And I know many of you are here to listen to Professor Peter Gore to discuss the life curve, and it's very, 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 very exciting piece of work. But as AHPs, we'll be taking forward this work on the 10th of May. So we are asking, as the Cabinet Secretary has already said, all AHPs working in adult services to ask 2 people that attend their service to undertake the life curve survey. I'm not going to go into it at all because Professor Gore is going to discuss that. But we're also going to collect the CHI data, and this will capture all the information, will provide rich data, not only just where we're intervening on a person's health and well-being journey, but the associated costs of what it costs to be on that level within the life curve. And that will help us do a lot of predictive modelling and work going forward in the future. So it's very, very exciting piece of work. And finally, this is work that's been, this model is based on the International Futures Forum framework for social change. And basically what this really depicts is this old world, which is the status quo. We can't carry on doing what we're doing. We've put this 2017 to 2020 as the kind of transition stage, the kind of disruptive innovation stage. And we believe that the initiatives that we're taking forward and the new initiatives, we really believe to start this whole transformation process that is required to deliver and to realise our AILIP vision. And then this will hopefully take us into this new world, which is where we can really start developing and delivering on some of the innovations. So finally, going back to our vision, I think the take-home message from this short presentation is that this AILIP vision is actually everybody's business. From an AHP perspective, and for the AHPs in the room, we need to ask ourselves, where are we intervening, with whom and at what time, and challenge what we're doing right now, and firmly embed what we're doing within this whole multi-agency, multidisciplinary work across sectors. And for the wider workforce within the IJBs, it's to fully utilise the AHP workforce, because if we're serious about the whole prevention agenda, then the AHPs do have the skills to address many of the challenges going forward. So thank you very much for that.
Great. That was a packed morning so far.